We say this all the time, but it is so important to remind you sleep is crucial to your overall health, especially for your brain.
Joining us now to share more in the sponsored interview is Dr. Catherine Kruliski from the University of Utah Health in the sponsored segment. And we can't stress enough how important sleep is, but we don't want you stressing about it either. You just have to do the best you can, but knowing how important it is.
Yes, definitely. So when I was preparing for this, I found out that actually 1 in 3 people do not get enough sleep. So they're sleeping less than 7 hours a night. Most people need about 7 to 9 hours a night of sleep. Everyone's a little bit different. I say this to all my patients when they come in. Let's focus on what you feel best with. But if you're having some mood symptoms, depression, anxiety, your memory is bad, and you're not within the usual category of a neurodegenerative, meaning dementia process, it's worthwhile to really evaluate how is your sleep.
So you said 1 in 3 aren't sleeping. I do not sleep last night. I think I'm the 1 out of the 3 of us, and I'm not alone. What happens to your brain, to my brain, when it's not getting enough sleep?
Yes, well, I don't want this to stress you out because that's not the purpose of this. My mom always said, eventually you'll sleep. So let's take the pressure off of it.
Okay.
But what's not happening is that it's actually active restoration. So there's a system that was found relatively recently. It's called the glymphatic system, and it cleans out the toxins and the harmful proteins within our brain, and it's only active during sleep.
So that's why it's so important. So when you have day after day of not sleeping, that can be an issue. That's why you might have some memory loss. That's why you might be foggy brain. Mm-hmm. So all the more important, and you just described some of the symptoms, what are the things that we can do to have that good quality of sleep? It's not just the number of hours, but it's the quality.
Totally. And we've heard of sleep hygiene, right? So you want a cold, dark room. We want consistent bedtimes and awakenings, even on the weekends. We basically want to do everything within our control to promote restful sleep. So we want to avoid screens an hour or two before bedtime, which in our society is actually very hard to do because it's so ingrained in our moment to moment. Those are the biggest things that come to mind. But sometimes if you're still doing those things, you're doing everything right, and you're still not feeling restored, that's when it's worthwhile to talk to somebody about it.
When do you know? When is it enough that you should talk to your doctor?
And also the other thing is that when you're in bed but not sleeping, it's worthwhile to just get out of bed and only use the bed for sleep. So if you are sleeping the full night and you're still feeling brain fog, you're not feeling rested, your partner says you're snoring super loudly and is elbowing you throughout the night, they see you gasping for air, those are all signs that you might have an undiagnosed medical condition that needs to be evaluated for. And I would say that actually obstructive sleep apnea, which some of those signs, is much more common than one would think.
Well, doctor, I have it. I tested myself, and surprising to me, not necessarily to me, but how I was right in the middle that I have sleep apnea. So it definitely is worth checking out. You never know, and you do find ways to get a better night's sleep by some of the options that are provided.
Totally, and you're a great example is that people have this idea in their heads, older people, men, overweight, those are the people that get obstructive sleep apnea. But no, that's not true. People that are way outside of that demographic are also having obstructive sleep apnea, and that's ruining their deep quality sleep.
Yeah, get better sleep for your brain health. Thank you, doctor, for being here, and our thanks to the University of Utah Health for that sponsored interview.